Hello, everyone, and welcome to the April edition of AOPA's State Policy Forecast. I'm your host, Sam Miller, and today I'll be giving you the most up-to-date information on the current OMP climate. With the help of our members, AOPA tracks and addresses state-level policy challenges across the country. I'll be giving you the scoop on some of those efforts over the next few minutes. To start things off, we're going to head to Texas, where a cranial remolding orthosis bill has seen some movement. HB 134, which mandates coverage of CROs for both craniosynostosis and deformational plagiocephaly, successfully passed out of the House Insurance Committee on April 11th with an 8-0 vote in favor. AOPA's CRO workgroup and a coalition of providers in the state assisted in this effort by providing testimony and gathering support from Texas-based healthcare organizations, physicians, and OMP practitioners. The bill now moves to the House floor for a vote. Next, we'll head to New York with some good news on this session's study bill. In late March, S 3131, which directs the New York Commissioner of Health to conduct a study related to New York Medicaid's rate adequacy and patient access, successfully passed the Senate and will now move on to the Assembly. The bill is identical to S 7023, which also passed the Senate during the last legislative session, but failed to move in the Assembly. Now, let's move on to North Dakota to learn more about a newly enacted coverage law. In March, North Dakota Governor Doug Burgum enacted HB 1411, which mandates coverage of prosthetic appliances and limbs for enrollees in North Dakota's health program for public employees and retirees. The bill faced little resistance in the legislature, passing out of the House with a 90-0 vote and the Senate with a 46-0 vote. All right, folks, there's the So Kids Can Move groove once again. It looks like we have some exciting news to share. So let's head on over to New Mexico to kick things off. HB 131, which prevents insurance companies from discriminating on the basis of disability in the provision of OMP care, has been signed into law by Governor Michelle Lujan Grisham on April 6th. Thanks to the grassroots efforts of patient advocates Kyle Stepp, Callaway Lewis, and many others in the state, the bill will take effect in January 2024. Next, let's move to Arkansas for another legislative win. Just last week, HB 1252, which mandates all ages coverage of one prosthesis for athletics or recreation and another for showering or bathing, was enacted into law by Sarah Huckabee Sanders with the help of Francois Vanderwaat, Frank Snell, and the Arkansas Society of Orthotists and Prosthetists. During the Senate side process, the bill was amended to limit recreational prostheses to running blade type devices intended for K3 and K4 patients. The bill will take effect in July 2023. Next up, we have Colorado. Let's head on over and see what they've been up to. With 62 votes for and only 1 vote against, HB 1136, which requires commercial private and group health insurance plans to cover activity-specific prostheses for enrollees of all ages, has successfully passed out of the House, thanks in part to continued support from the Rocky Mountain OMP Coalition. The bill will now move to committee assignment in the Senate. Finally, let's move to Illinois, where there's been some similar legislative movement. SB 2195, which mandates coverage of activity-specific orthoses and prostheses for commercial health plans for enrollees of all ages, has passed the Senate with the help of Jim Kaiser and the Illinois Society of Orthotists and Prosthetists. Folks, we have some breaking news. As of just now, SB 2195 has passed the House Insurance Committee with an 11-0 unanimous vote in support. Amazing news. Well, that just about wraps things up. Thank you for listening to this month's State Policy Forecast. For more OMP state news, please make sure to check out the AOPA Co-op and the state-by-state section of the OMP Almanac. And if you're interested in federal advocacy, please join me in Washington, D.C. on May 10th and 11th for our annual policy forum, where you'll learn about AOPA's legislative priorities and then meet with your members of Congress to advocate for the OMP community on Capitol Hill. Hope to see you there. This is Sam Miller, signing off.